My name is Nadira.
My name is Anis. So,
Our video is about drug
interaction.
The desirable and undesirable effect of a drug are generally related to its concentration at the site of action, which in turn is related to the amount administered and to the drug absorption, distribution, metabolism, or excretion, and also drug-drug interaction. An interaction is said to occur when the effect of one drug are changed by another drug, food, drink, or environmental chemical. Drug interaction can arise in numerous ways, such as pharmacodynamic interaction, in which receptor effects of different agents interact to produce synergy or antagonism. Drug effect in pharmacokinetic interaction, the blood level of given agent may be raised or lowered based on the type of interaction. When two antiarrhythmic drugs are administered concurrently, the patient may experience additive effect and is at increased risk of drug toxicity.
Okay, now I want to talk about the classification of antiarrhythmic drugs. Antiarrhythmic drugs are divided into 5 classes, which are class 1, 2, 3, 4, and 5. The example of these classes is shown here.
Okay, now I'm going to talk about example of arrhythmic drug-drug interaction. So for the first example is between class 1 with class 5. Quinidine increased plasma digoxin concentrations by displacing it from tissue binding sites and decreasing its excretion. Therefore, dose of digoxin should be decreased when drugs are used together. Next example is between drug class 1 with class 4. When quinidine is administered with verapamil, there is an increased risk of hypotensive effects. Next is class 1A with class 1A. When quinidine and procainamide are administered with digitalis, the risk of digitalis toxicity is increased. Pharmacologic effects of procainamide may be increased when procainamide is administered with quinidine. Example of class 1 drug with class 1B. There is a potential of additive cardiodepressant effects when procainamide is administered with lidocaine. Example of class 1A with class 2. Propranolol may increase procainamide plasma levels. Additive cholinergic effects may occur when procainamide is administered with other drugs with anticholinergic effects.
The interaction between class 1B with class 2. The example is lidocaine with cimetidine, which is the drugs to treat stomach ulcer. Decreased hepatic blood flow besides cimetidine may increase plasma concentration of lidocaine. Cimetidine may also slow down the rate elimination of class 2 and class 4 antiarrhythmic drugs. The next one is the interaction between class 1B with antihypertensive drugs. The example given is phenytoin that can accelerate the breakdown of these drugs. Conversely, cimetidine, which inhibits oxidase system, can increase antihypertensive drug levels, resulting in greater therapeutic effect. The next one is interaction between class 1C and class 3. It has been suggested that adding sotalol to propafenone therapy may be useful in patients with recurrent atrial fibrillation. However, combination antiarrhythmic therapy may result in unanticipated increases in plasma concentration and should be pursued with caution.
The next interaction is between class 2 with class 1B. When a beta blocker such as propranolol is administered with lidocaine, there is an increased risk of lidocaine toxicity. Next is class 2 propranolol with class 4. This will lower the blood pressure and heart rate and will cause a dangerous drop in your blood pressure and or heart rate. The next one is class 2, which is propranolol with cigarette smoking, nicotine. This will speed up the liver's breakdown of propranolol, and this can lower the amount of propranolol in your bloodstream, which may affect the dosage of intraoral local anesthesia that you will need in order to treat your high blood pressure or prevent chest pain or migraine attacks. The next one is class 2, propranolol with NSAID or non-steroidal anti-inflammatory drugs. For example, indoxin. This will make the propranolol less effective at lowering high blood pressure and heart rate. Next one is class 2, propranolol with antidepressant. For example, monoamine oxidase inhibitors or tricyclic antidepressants that can cause blood pressure level to drop to low.
QT prolongation predisposing patient to atypical ventricular tachycardia. Next is class 3 and class 1B. Increases serum phenytoin concentration or decreases amiodarone concentration. Delay onset. For the class 3 with class 2, amiodarone may interact with beta-blocking agents and some of the calcium antagonists to produce symptomatic sinus bradycardia and sinus arrest, especially in a latent or oversick sinus syndrome. For the class 3, with anesthetic agents, during surgery, amiodarone induces hypotension and an atropine-resistant bradycardia, possibly by interacting with anesthetic agent. For the class 3 with class 1A, the combination of sotalol plus type 1A drugs such as quinidine and procainamide appears to be highly effective in preventing recurrence of sustained ventricular tachycardia. Furthermore, the combination is associated with a marked prolongation of cardiac refractoriness, which may be associated with clinical benefit. Interaction of quinidine with sotalol did not enhance the risk of toxicity pointers, or TDP.